Yeah, of course. So chronic kidney disease, the word chronic simply means something's been around for a long time. And kidney disease is clearly disease that's affecting our kidneys. So chronic kidney disease is a problem where the kidneys, and it's always both kidneys, are damaged by some disease process that has been going on slowly and for some quite considerable time, usually months or even many, many years. So most patients with chronic kidney disease, in fact, have no signs or symptoms at all. And this is one of the major problems with kidney disease. It does not cause symptoms. If you've got heart disease, you usually get pain or shortness of breath, but kidney disease just causes no symptoms at all. So it's only detected really if people have had a blood test that might suggest their kidneys are not working normally, or a urine test which shows abnormalities in the urine. In late kidney disease, it is possible that symptoms can arise. Kidneys never cause pain, but they can cause problems with passing urine, but more importantly, complications such as leg swelling and shortness of breath, but these really only occur late and are not found early in kidney disease. For most people who develop chronic kidney disease, it is caused by another problem. And most commonly, this is diabetes or hypertension, or sometimes a complication of high blood cholesterol levels, where the blood vessels in the body have been damaged. And those three factors make up well over half of all people with chronic kidney disease, and in some places, almost 2/3 of people. So they are actually already know they've got a problem, high blood pressure or diabetes, usually. There are lots of other causes, but they're all much less common. It is possible that kidney disease can be caused by long-term medication use, and there is a small number of medicines that can damage kidneys. And there are some inherited diseases, the commonest being something called polycystic kidney disease, that can lead to chronic kidney damage, chronic kidney disease. This often, but not always, runs in families and actually accounts for about 10% of people with chronic kidney disease. So those are the main causes altogether, but actually the vast majority of people already have some other medical problem. And so having tests for their kidneys will pick up the fact that they also have kidney damage. So chronic kidney disease is diagnosed by having a blood test that measures the kidney function, and this is called the blood creatinine level, and sometimes reported also as an eGFR, which stands for estimated glomerular filtration rate, which is a bit of a mouthful. But GFR really just means percentage kidney function. So a normal GFR would be well over 60, and in young people often over 90. And terrible kidney function is that GFR number being 10 or lower, and the range is in between the two. And that's the best marker for how well the kidneys are cleaning the blood. A urine test is really, really important too, and measuring the urine protein. And normally we don't have any protein in the urine, it all stays in the body. And if your kidneys are damaged, they leak protein, which appears in the urine. And we measure this by measuring something called a urine protein creatinine ratio, or sometimes a urine albumin creatinine ratio, which just tells us how much protein, and albumin is just a protein, there is, and it should be 0, and numbers that are big tell us there's lots of protein. And this is a very important measure because some of the treatments I'll talk about in a moment, we can tell if they're working if the urine protein gets lower and lower and lower, which is a really good sign. Even if the kidney function blood test, that GFR number, doesn't change and just stays stable. So they're the two critical things that we measure and monitor. There are some other things if the kidneys are particularly bad, but those are the two key tests for monitoring kidney health and kidney function. So dietary and lifestyle changes are really important in managing chronic kidney disease. Chronic kidney disease is the major problem is vascular blood vessel problems, and it leads to strokes and heart attacks, problems with worsening blood pressure and the long-term consequences. So lots of the interventions are all about reducing risk of cardiovascular disease. So the first thing is, if you smoke, definitely stopping smoking makes a very big difference. Smoking isn't just bad for lungs and hearts, but actually makes kidney disease worse and actually stops some of the important medicines that we have from working. So smoking cessation, very important. Exercise is an amazing medicine, and none of us probably do enough, but all forms of exercise are really important, and in kidney disease have shown to slow damage, to protect the heart, protect the kidneys, and is critical. And it doesn't matter what exercise, but any exercise you can fit around your life, and ideally a combination of some aerobic exercise and some weight-bearing exercise over the course of a week, and trying to do 4 or 5 days of at least 30 minutes would be excellent advice. And this is not a placebo. This is doing amazing things in the body to protect not just the kidneys, but the heart and the blood vessels as well. Dietary wise, don't go looking up kidney diet. What you'll get is loads of advice about stopping eating bananas and fruits with potassium. And for most people with early kidney disease, that is completely rubbish advice. There are some people with the most severe kidney disease in whom that is accurate, but not for most people with chronic kidney disease. So most people with early chronic kidney disease should fundamentally eat a diet rich in fruit and vegetables, and the whole range of fruits and vegetables, and a more plant-based diet is much better than eating a lot of meat. Meat protein, the kidneys have to work quite hard to get rid of from the body. So a more plant-based diet and the whole range of fruit and plants and vegetables is very good. And plant proteins such as chickpeas and lentils and beans are really good. And generally not too much salt. So you can cook with salt, but most salt we eat is in processed foods and pre-prepared foods. So trying to avoid those. Clearly, occasionally it's fine, but not too many processed foods, and don't add extra salt when you eat your food. And staying well hydrated. That doesn't mean drinking vast amounts of fluid, but you should be drinking fluid regularly through the day to make sure you're not dehydrated. So in hot weather or in air-conditioned rooms, that's especially important. And people always ask about alcohol, and the good news, if you like it, is a small amount of alcohol is perfectly good and possibly helpful for kidneys. So you don't have to stop enjoying your glass of red wine or your whiskey or your beer in moderation. So now treatments for chronic kidney disease, and just remember the diet, the exercise, all really, really important, but there are now extra treatments. Even a few years ago, we did not have many treatments that would be helpful, but actually now we're in very exciting times and there are really quite a few more medicines available. Most of them cannot reverse the kidney damage, but they can certainly slow down ongoing damage, sometimes stop damage getting worse altogether, and so protect kidneys, and very importantly stop people getting those other complications I mentioned before, heart attacks and stroke, so protect your cardiovascular system. So the treatments first of all are aimed at the underlying cause. So if you've got diabetes, making sure the diabetes is well controlled. If you have high blood pressure, making sure the blood pressure is well controlled. For blood pressure, well controlled means actually much lower numbers than in the general population for people who don't have kidney disease. And in most people, we're aiming for a blood pressure less than about 130 for the top number, over 80 for the bottom number. So 130 over 80 or lower. But in people who are much older and a little bit frailer, for example, if you're 80 years old, we wouldn't be quite so strict and we would relax those numbers slightly. And if you're only 25 and you're unlucky enough to have chronic kidney disease, slightly lower numbers, 120 over 80 might be a target. But that's the sort of range, so excellent control of blood pressure. And now there are some classes of medicines that seem to be particularly important. So there's a group of medicines called ACE inhibitors and another group called the angiotensin blockers. These are not new, they've been around for 30 years, which were originally designed to treat blood pressure, hypertension, but we now know also are very good at protecting the kidneys. And almost everybody who's got chronic kidney disease would need to be on one of these groups of medicines, and there's a whole family of them, and it doesn't matter which one. So these groups of drugs are very good for both lowering blood pressure and protecting the kidney. And then more recently, in the last 5 years, a group of drugs and medicines called the SGLT2 inhibitors. That's a mouthful, isn't it? They're sometimes also called flozins, and there are 3 or 4 of these around in different countries. The commonest is a medicine called dapagliflozin or empagliflozin. So they all end in that flozin bit. These medicines were designed for people with diabetes, but have turned out to be really effective in people without diabetes to protect the kidneys and the cardiovascular system. And so right now we've got very good evidence that adding these in to people with chronic kidney disease will certainly protect their hearts and their blood vessels and slow down any progression of their chronic kidney damage. So most people with chronic kidney disease would need to be on more than one medicine, I'm afraid, and all of these will be forever because the kidney disease does not go away, but they do seem to stop you dying early and from stopping the kidneys getting worse, which are clearly both very important effects. And then right now there are 2 or 3 other medicines just finishing trials which aren't quite available yet, though one of them has just reached several countries, called finerenone. So the whole future looks really quite rosy for new medicines that are going to be helpful in chronic kidney disease. That last group I just mentioned, the flozins, they lower blood pressure, they protect the kidneys. Some people notice they pass a bit more urine when they start, and they also make you lose a little bit of weight, which can be a good thing for most people too. And GPs are very good at prescribing these and will start them in almost all people where they're needed, and we'll talk about the potential very small risks, as with all medicines, but the major benefits for many people.